Understanding childhood diarrhea, causes, symptoms, and safe home treatments. As parents, one of the most concerning and unsettling experiences is when our little ones suffer from diarrhea. Childhood diarrhea is a common condition that affects children worldwide. This unpleasant condition, characterized by frequent loose and watery stools, can strike fear into the hearts of even the most seasoned caregivers. However, it's essential to remember that childhood diarrhea is a common occurrence and in most cases, not a cause for immediate alarm. While it can be unsettling to witness, in most cases, childhood diarrhea resolves on its own within a few days. However, it's crucial to understand the causes, symptoms, and safe home management strategies to ensure your child's comfort and well-being. Today, we will go through the causes, symptoms, and safe home treatments for childhood diarrhea. What is childhood diarrhea? Childhood diarrhea is the passage of 3 or more loose or watery stools within 24 hours. It can be acute, lasting less than 14 days, or chronic, persisting for over 2 weeks. Diarrhea in children is often a symptom of an underlying condition, such as an infection, food intolerance, or digestive disorder, rather than a standalone illness. Causes of childhood diarrhea: viral infections. Childhood diarrhea is often a result of viral, bacterial, or parasitic infections. These viruses primarily target the gastrointestinal tract, leading to inflammation and increased fluid secretion, resulting in diarrhea. Common culprits include rotavirus, norovirus, and adenovirus. These infections can be transmitted through contaminated food, water, or contact with an infected person. Bacterial infections. Certain bacterial infections like Escherichia coli, E. coli, and Campylobacter can also cause diarrhea in children. These bacteria can be transmitted through contaminated food, water, or contact with infected individuals or animals. Salmonella and other bacteria can cause diarrhea, often accompanied by fever and abdominal cramps. Parasitic infections. Parasites like Giardia lamblia and Cryptosporidium parvum can infect the intestines and cause diarrhea, especially in children with weaker immune systems or those who have consumed contaminated water or food. Food intolerances and allergies. Some children may experience diarrhea due to food intolerances or allergies, such as lactose intolerance or an allergy to certain foods like cow's milk, soy, or wheat. Identifying and managing these dietary triggers can significantly improve the child's well-being. Medications. Certain medications, including antibiotics, can disrupt the normal balance of gut bacteria, leading to diarrhea as a side effect. Careful consideration and consultation with healthcare providers can help minimize these effects. Digestive disorders. Underlying digestive disorders like inflammatory bowel disease, IBD, celiac disease, or short bowel syndrome can also contribute to chronic or recurring episodes of diarrhea in children. Stress and anxiety. Emotional factors, such as stress or anxiety, can contribute to diarrhea in children. Changes in routine, school-related stressors, or familial disruptions may manifest as gastrointestinal issues. Creating a supportive environment and addressing emotional well-being is paramount in such cases. Common myths about childhood diarrhea. Myth: diarrhea is no more serious than the common cold. Reality: diarrhea is often underestimated in terms of its severity. In reality, it is the second leading killer disease of children under 5 years old worldwide. Without fast access to treatment, children can die. Myth: teething causes diarrhea. Reality: many parents believe that teething can trigger diarrhea in babies. However, pediatricians assert that this is not true. If a baby has diarrhea or a fever during teething, it's likely due to a virus, not the teething itself. Myth: diarrhea is a short-term problem. Reality: while diarrhea episodes may pass, repeated exposure to stomach bugs can cause long-term damage to a child's health, including malnutrition and cognitive growth shortfalls. Myth: sugary foods are okay for rehydration. Reality: very sugary foods and drinks, including natural sugars found in fruit, may worsen diarrhea symptoms. Sugar draws fluid into the intestines during digestion, diluting stools and worsening diarrhea. Symptoms of childhood diarrhea: frequent, loose, and watery stools. The primary symptom of childhood diarrhea is the passage of frequent, loose, and watery stools. A noticeable increase in the frequency of bowel movements is another primary symptom of diarrhea. Depending on the underlying cause, bowel movements can range from a few to several times daily. Abdominal cramps and pain. Many children with diarrhea experience abdominal cramps or pain, which can be mild to severe depending on the severity of the condition. Fever. Occasionally, diarrhea may be accompanied by a fever, particularly if a viral or bacterial infection caused it. Monitoring and managing fever are integral to caring for a child with diarrhea. Nausea and vomiting. Children with diarrhea may also experience nausea and vomiting, which can lead to dehydration if not managed properly. This further contributes to fluid loss and requires careful attention to hydration. Dehydration. One of the most significant concerns with childhood diarrhea is the risk of dehydration. Children can quickly lose fluids and electrolytes through frequent loose stools, leading to symptoms like dry mouth, sunken eyes, lack of tears when crying, and decreased urine output. Monitoring hydration levels is crucial for preventing complications. Loss of appetite. Diarrhea can cause a loss of appetite in children, which can further contribute to dehydration and nutritional deficiencies if prolonged. Safe home treatments for childhood diarrhea. While professional medical advice is paramount, certain safe home treatments can help manage childhood diarrhea and provide relief to the child. Oral rehydration solutions, ORS. The most effective and recommended home treatment for childhood diarrhea is oral rehydration solutions, ORS. These solutions contain a balanced mixture of water, electrolytes, and sugars, which help replenish fluids and prevent dehydration. ORS can be purchased over the counter or made at home by boiling a liter of water, adding a teaspoon of sugar and salt, and mixing it up. Maintaining adequate hydration is crucial. Encouraging the child to drink oral rehydration solutions, ORS, or clear fluids in small, frequent amounts can help replace lost fluids and electrolytes. BRAT diet. The BRAT diet, which stands for bananas, rice, applesauce, and toast, can help manage childhood diarrhea. These bland foods are easy to digest and help bind loose stools while providing essential nutrients. Avoiding dairy, fatty foods, and sugary beverages is advisable during episodes of diarrhea. Also, avoid introducing new foods during an episode of diarrhea. Probiotics. Probiotics, which are beneficial bacteria found in fermented foods like yogurt or available as supplements, can help restore the balance of gut flora and alleviate diarrhea symptoms. However, consult your pediatrician before administering any supplements to your child. Rest and fluid intake. Ensuring your child gets adequate rest and encouraging frequent fluid intake, such as water, broths, or electrolyte-rich beverages, can help prevent dehydration and facilitate recovery. Over-the-counter medications. In some cases, over-the-counter medications like loperamide for children over 2 years old or bismuth subsalicylate can help control diarrhea symptoms. Still, it's essential to consult your pediatrician before administering any medication to your child. Maintaining good hygiene. Practicing good hygiene, including thorough hand washing after using the toilet and before meals, helps prevent the spread of infections causing diarrhea. Seeking medical attention. If diarrhea persists, worsens, or is accompanied by severe symptoms such as high fever, blood in stools, or signs of dehydration, seeking prompt medical attention is imperative. Professional guidance ensures accurate diagnosis and appropriate treatment. When to go to the hospital. While most cases of childhood diarrhea can be managed at home, there are instances when seeking medical attention is necessary. These include dehydration. Dehydration is the most significant concern with diarrhea. If your child displays signs of dehydration, such as dry mouth, sunken eyes, lack of tears when crying, or decreased urine output, it's crucial to seek medical care immediately. Bloody stools. The presence of blood in your child's stools can be a sign of a more serious condition and should be evaluated by a healthcare provider. Severe abdominal pain. Severe or persistent abdominal pain can indicate a more severe underlying issue and warrants medical attention. High fever. A high fever, typically above 102 degrees Fahrenheit, 38.9 degrees Celsius, accompanied by diarrhea, can signify a bacterial or viral infection that requires medical evaluation and treatment. Prolonged diarrhea. If your child's diarrhea persists for more than 2 weeks, it may be a sign of an underlying chronic condition that needs medical attention. Preventing childhood diarrhea. While it's not always possible to prevent childhood diarrhea, there are several measures you can take to reduce the risk. Proper hand washing. Encouraging regular and thorough hand washing, especially before eating and after using the restroom, can help prevent the spread of infections that cause diarrhea. Food safety. Practicing proper food handling and preparation techniques, such as cooking foods thoroughly, avoiding cross-contamination, and refrigerating perishable items promptly, can reduce the risk of foodborne illnesses that lead to diarrhea. This technique is necessary for both the child and caregivers. Educating caregivers. Educating parents, guardians, and caregivers about the causes, symptoms, and safe home treatments for childhood diarrhea empowers them to respond effectively to this common childhood ailment. By recognizing the various factors contributing to diarrhea, caregivers can implement preventive measures and respond quickly when symptoms arise. Breastfeeding. Breastfeeding has been shown to provide protective antibodies that can help strengthen a baby's immune system and reduce the risk of diarrhea in infancy. Vaccinations. Ensure that children receive vaccinations for preventable infections. Also, keeping your child's vaccinations up to date, including the rotavirus vaccine, can help prevent certain types of diarrhea caused by viral infections. Maintaining a healthy diet. Encouraging a balanced and nutritious diet supports overall gastrointestinal health. Adequate fiber intake and various nutrient-rich foods contribute to a healthy digestive system. Clean water and sanitation. Ensuring access to clean drinking water and proper sanitation facilities can significantly reduce the risk of diarrhea caused by waterborne illnesses. Promoting emotional well-being. Creating a supportive and stress-free environment for children aids in preventing diarrhea related to emotional factors. Open communication and addressing emotional needs are essential components of preventive care. With proper care and attention, childhood diarrhea can be effectively managed and children can recover quickly. Childhood diarrhea can be a distressing experience for both children and parents, but understanding its causes, symptoms, and safe home treatments can help you navigate this challenge with confidence. By understanding childhood diarrhea, you can effectively manage your child's diarrhea, prevent dehydration, and promote a speedy recovery. Remember, most cases of childhood diarrhea are self-limiting and resolve within a few days with proper care and attention. However, if you notice any concerning symptoms or your child's condition does not improve, it's always best to seek medical advice from a healthcare professional. With the right knowledge and care, you can help your little one overcome this unpleasant condition and get back to their happy, healthy selves.